to come on here because I have a special announcement to make. We are expecting baby number 5 into our family. Absolutely kidding, I would die, my husband would kill me. But I am here to talk about pregnancy and breastfeeding in relation to products and treatments, not just in general. So this is a question that I get asked a lot about, A, just because of the industry that I'm in, but B, also just having kids myself and sort of being open about the whole pregnancy and breastfeeding thing on Instagram. But it is also a topic that I have always avoided like the plague for so many reasons. One, you can find positive and negatives to almost everything I'm going to go over on the internet, so I just don't want 100 comments of, well, this website says not to do that, or this doctor said to do that. It's a very controversial, touchy subject, and obviously I'm going to start with a disclaimer. Anything that I say on here is my view at this time. Get everything checked with your doctor before starting anything when you're pregnant or breastfeeding, and there's a lot of reasons behind that too. Products change, so percentages of active ingredients can go up or down, and that might take them on or off the it's okay list. And also protocols are always changing. We're always learning new things, so anything that we talk about here, check with your doctor before doing if you're pregnant or breastfeeding. And if you are, congrats. So one of the main reasons that this is such a tricky topic to discuss and advise on is because there's really such a lack of data out there. So all of these procedures and products that we're doing are really for cosmetic reasons, and because they're not medically necessary, there's not going to be the same sort of studies that there would be if they were medically necessary. So we're not going to have testing done on women to see at what point a certain ingredient is going to affect their baby if we don't need to. So just due to the lack of data, all of the major companies and us ourselves just sort of err on the side of caution and just say, if we don't know, don't risk it when you're pregnant. That being said, I'll sort of guide you through what I do and do not do when I'm a baby factory. One other thing that I want to touch on is with all of these procedures and products, if you did any of them in the beginning before you found out you were pregnant, say you had a laser hair removal session, or you had your lips done, or you didn't stop using a product with retinol in it, don't beat yourself up over it. This happens to so many women before they actually realize that they are pregnant, and there really hasn't been any clear cases of where this has had any effect on the baby. Again, people just want to be really cautious. It's not worth taking the risks when you are pregnant, but if something did happen and you did have a laser treatment before knowing, don't beat yourself up. Chances are everything's fine. You got this. You're doing good. So I'm going to quickly run through all of the different procedures, lasers, injectables, and then products, the do's and the don'ts, and then just some tips and tricks to get you through these glorious 9 months. And fun fact, before I got into this industry, I was actually going to school to be a midwife, and I was working as a birth doula and a lactation consultant while I was in school as well. So this is kind of my jam. So let's start with laser. Although there are many doctors and dermatologists out there that do believe lasers are safe during pregnancy and breastfeeding, I personally advise against it, and we do at the clinic as well, for a few reasons. So the first reason, obvious, again, like I said before, because it's cosmetic, they just haven't done full studies on it, so they don't know the effects. And although there are light-based lasers like IPL that are considered really safe, it's still just not worth it in our opinion for a few other reasons. One of them being hormones. If you've ever been pregnant or been around anyone who's pregnant, you obviously know that hormones can be all types of crazy and out of whack. And because of your hormones being different during the time of pregnancy, even if you react great to light-based lasers like IPL when you're not pregnant, you can react completely differently when you are pregnant. When you're pregnant, you can be more prone to pigmentation, and the last thing we want to do is to cause any hyperpigmentation. So it's just not worth the risks until your hormones have settled. And again, a lot of clinics will do laser, especially for those who are breastfeeding. But for me, I just say wait it out, especially for your face. You don't want to cause any pigmentation. If you are starting to develop melasma, which is also known as pregnancy mass, the last thing you want to be doing is put any heat-based lasers on your skin, as that can just amplify it. So wait it out, be safe. And one of the last reasons why I don't personally advise having laser is pain. So if you're pregnant, the last thing you want to be doing is inflicting pain or discomfort on yourself. You will be more sensitive when you're pregnant, but also just if you're feeling discomfort or stress, that's not really the environment that you want to have your baby in. So it's just an all-around good idea to wait till after you've had the baby, and it's an even better idea to just wait till you're done breastfeeding. One other thing to talk about with laser is laser hair removal. So if you've already had laser hair removal, don't be surprised if you start seeing a few hairs sprouting up here and there. Anytime you have a huge hormonal flux, that can stimulate hair growth. So even if you have had laser hair removal in the past, you might find that it stimulates some hairs. Not that it's going to completely erase everything that you've done with your laser hair removal treatments prior to getting pregnant, but you might find that you have to do a few touch-ups. So for me personally, I did 2 or 3 sessions just to sort of zap a few stray hairs that popped up after I finished breastfeeding. Hair with pregnancy is a tricky subject because you're going to find it's sprouting up in places you don't want it, and it's falling out in the places that you do. We'll touch on hair when we get to products. Botox. I hate to say it, but just don't. Any neurotoxins, Botox, Xeomin, Dysport, Nuceiva, you can't use them when you're pregnant, and you cannot use them while you're breastfeeding. They're just not considered safe. This is the one thing I get asked about so much because it's the one thing that you can do for your skin where you see such dramatic effects when you stop using it cold turkey. But again, it's only 9 months. It's totally worth the wait. Don't take any risks. I have so many people message me on Instagram. I'll tell them no. A month later, they'll message back, are you sure? Just a little bit? Again, it's just a full no. No across the board. No neurotoxins. Also with Botox, you do want to be really cautious. So even if you aren't already pregnant or breastfeeding, but you're trying to get pregnant, or you're not on birth control, so getting pregnant is a possibility for you, just make sure you're being extra safe when it comes to Botox injections. This is where it gets a little gray. So a lot of fillers are hyaluronic acid based, which is something that your body naturally produces. Across the board, all doctors should be saying absolutely don't do it while you're pregnant. We just don't know the effects that it could have on the infant. Although the fillers are supposed to just stay in the area that they're placed, it's just, again, it's something that's not studied. It's not worth taking the risks. As far as when you're breastfeeding, this is where you'll get mixed opinions. So I know all of our doctors here say just wait, again, not worth taking the risk. We don't know how it'll affect the infant. You will find some doctors out there that will do it while women are breastfeeding. I'm going to admit, again, do as I say, not as I do, but I like to be completely transparent and honest on these videos. When I was breastfeeding, I did do some filler in my lips, I believe, but it was when my baby was older, so she was now also eating solid foods. It wasn't when she was a newborn, and I was just sort of comfortable with that, and my doctor at the time. But that being said, for overall advice, I would say just don't do it, don't take the risk. Yeah, not worth it. I shouldn't have done it. And again, the main reason for saying no to things like fillers while breastfeeding is it's the unknown. No one's going to do a study on it. No one's going to test it just because it's not medically necessary. So on the side of caution, it hasn't been tested, let's not do it. Now on to non-laser based in-clinic procedures. So that would be like your chemical peels, your microdermabrasions, and your facials. Chemical peels. There are some doctors and derms out there that are lenient and allow some peels to be done during this period of time, mostly your beta hydroxys like your glycolic and your lactics. I just advise against it. You would have to use such a low percentage for it to be questionably safe that it's just not worth it. Wait till you're done breastfeeding before you do any chemical peels. If you're an absolute peel addict, The one that I do recommend for pregnancy is the Enzymatic peel, and this is one that you can do at home even twice a week. It's not going to be as strong as an in-clinic peel, but you're making human. It doesn't need to be. Go home, treat yourself with this. It's much safer. It's a good one to try. And the one thing that I do want to say when it comes to products, which we're going to get to, is you also want to think of your surface area. So if you don't need to, with any of these products, just to play it on the safe side, don't do more of a surface area than you need to. If it's just your face, like say you're trying to treat some hormonal acne, this enzymatic peel is great, but it's not something you need to be slathering on your whole body. And of course, you're always going to want to avoid the chest area. Facials and microdermabrasion. So finally, something that you can do while you're pregnant, and this is nice because you can sort of pamper yourself. It's not zapping and poking like the other procedures. It's kind of nice and relaxing anyways. The only thing that you do have to keep in mind is you must make sure when you are booking your appointment and when you show up for your appointment, let your technician know that you are pregnant or breastfeeding, just so that they know and they're using the right products. Especially with our clinic, we have a lot of really strong medical grade products here, so even if you are coming in for something gentle like a microdermabrasion or a facial, we need to know that so we can choose your products accordingly. Hair loss and hair thinning. This is a real issue for a lot of women who are pregnant or breastfeeding, and there's not a ton you can do about it, but here are my tips on that. For hair thinning, Viviscal Pro is something that a lot of people use. You cannot use this while you're pregnant or breastfeeding, but as soon as you're done breastfeeding, it's something you can start incorporating into your routine if you like. This isn't going to make your hair necessarily grow longer, but it does thicken the hair. So if you found that you had thinning, this is a good one to sort of supplement that. Another product that is really popular for this is True Marine Collagen. So again, just because companies want to be extra safe and cautious and don't want the liability, there haven't been necessarily tests done on this. So the company itself says always check with your doctor just to get the okay, but it is a 100% natural product that has no side effects. So for me personally, I was using this when I was later into my pregnancy, and then again when I was breastfeeding in the later months, and I felt that it really helped my hair. I attribute this, if you've seen videos before, well, I was wearing extensions, so it's probably not a good reference point, but I did have really short hair at one point, and I feel like this in my coffee every morning really helped. This product, however, is not vegan, so before you start messaging me, I know it's the one product that I will throw a blind eye to, and I'm glad I did because I feel like it's really helped with my hair. But again, just talk to your doctor, but it's all natural, no side effects. If anything like that concerns you, the one thing that I personally do is I avoid it in sort of the more sensitive stages. So with pregnancy, obviously the first trimester, the first 3 months, just avoid everything. And then you can start introducing things in if you feel comfortable with them. And then even with breastfeeding, again, first 3 months when the baby's so little and so new and breast milk is all they're getting, you might want to avoid certain things. And then as the baby sort of gets bigger, stronger, eating solids, that's when you can start introducing things in as well. Products, or more specifically, even just ingredients, but I will also get to specific products. So one product that is on the avoid list is salicylic acid and BHAs, and those are beta hydroxy acids. So salicylic acid is pretty much agreed across the board, completely avoid while pregnant. Some doctors are a little more lenient when it comes to breastfeeding. So there are many doctors out there that just say avoid it altogether. So again, check with your doctor and what they recommend for you. But there are other doctors and derms out there that feel as long as it's a low percentage and a low surface area, you're okay. So if we're looking at a 2 to 3% salicylic acid in like a face wash or something like that, I would never go higher than 3%. And as long as you're looking at a small surface area. So if you're really dealing with bad breakouts and you want to use your salicylic wash, as long as it's the low percentage, and just treat the area that you feel you need. I wouldn't do more than the face. So don't be bathing in a salicylic wash. Don't carry it down onto your chest or anything that can transfer onto the baby when they're breastfeeding. But again, check with your doctor, but there are some derms out there that feel as long as it's not higher than a 2 to 3%, you're fine. Once we start looking at peels, like we get up to a 15% salicylic, then there's just questions about the risk of systemic absorption. For me personally, I would use a little bit of salicylic acid, which was in the ZO complexion renewal pads when I was breastfeeding. But again, that wasn't in the first 3 months, and it was on the very rare occasion. So I was just using it in areas where I felt congested or breaking out about once a week if I really felt like I needed it. But it was further into breastfeeding, low percentage, low surface area, but check with your doctor. When it comes to AHAs, alpha hydroxy acids, that's where you will find a lot of doctors that feel those are safe, again in low percentages. So your glycolics, your lactic acids, just keep them low, surface area low, don't go anywhere near your chest if you're breastfeeding. Benzoyl peroxide, I would say that's a straight no. There are some doctors out there that feel like it's okay in small amounts, but generally speaking, the verdict is no. No benzoyl peroxides. Vitamin A or retinol and retinoids. So that again is a no for pregnancy and breastfeeding, and that's a really hard one for people to let go of because people love it. So again, it's only 9 months, don't use it. There are some products in the ZO line where technically they just take them off the list of products you can use because they do contain retinol in them, but they're such small doses. They're what we call whisper doses. So they're not even on the label as a percentage of retinol. They're really just in there to stimulate the cells. So Daily Power Defense is one of those products. So again, technically it's off the list because there is some retinol in there, but it's such a low dose that there's a lot of doctors and derms that say it's completely safe to use when you're breastfeeding. Again, check with your doctor for you personally, but when it comes to me, when I was pregnant and breastfeeding, I did use Daily Power Defense just because I couldn't live without it, and I had talked to a lot of doctors and derms that said it was such a small microdose in there that it wouldn't be something that would be absorbed or to be concerned about. But full disclosure, it is off the list of products that ZO publicly says that you can use while you're pregnant because there is some retinol in there. So again, it's where you need to feel it out, talk with your doctor about it just to figure out what's right for you. So other stronger vitamin A based medications like prescription drugs like Accutane, that is a firm no. So we don't actually prescribe that at the clinic. We like to use other techniques, but if you are on Accutane for severe acne, that is something you have to be so careful with because it is linked to birth defects. So I believe now if you are getting a prescription for Accutane, you have to show to your doctor that you're on 2 forms of birth control just to make sure there's no accidents and no chances of you getting pregnant. But do keep that in mind if getting pregnant is something that's in your future and you are on prescription drugs like Accutane. You might want to start, before you start trying to get pregnant, to transition into other ways to treat your acne so that it's not just going to be a full-blown stop and then trying to get pregnant. And the one last major ingredient that's on my list of absolute no's during pregnancy and breastfeeding is hydroquinone. So the reason why this is an issue for a lot of women is because pigmentation and melasma, also known as pregnancy mass, is a huge issue for women when they're pregnant. Melasma can often come up during pregnancy with the hormonal fluctuations, and hydroquinone is kind of that gold standard for treating it. So hydroquinone is a very serious, strong ingredient, and it is systemically absorbed. And it's thought that about 30 to even 45% of the product is systemically absorbed and passes that transcutaneous border. That being said, hydroquinone is amazing for treating melasma and hyperpigmentation, so you absolutely have to avoid it when you're pregnant and when you're breastfeeding. But if melasma is something that's come up for you during that time, I would definitely recommend, once you're planning to stop breastfeeding, come in for a consultation to talk about the ZO hydroquinone system so that you can treat your melasma. And if you're interested in it, you can check out our hydroquinone video. So that was the bad news. Those are all the ingredients that you really do need to watch out for when you are pregnant or breastfeeding. But now on to the good news. Here's some stuff you can actually put on your face. Acne can happen for various reasons when you're pregnant and breastfeeding. So some main issues are you've come off your birth control, your hormones are different, as well as you're using different skincare. So you're no longer using your salicylics and your retinol, so acne can flare up. So some women might find it frustrating to deal with acne during pregnancy and breastfeeding just because a lot of the ingredients that they would normally use to treat it are on the no list. there are several things that you can still use. Alpha hydroxy face washes are generally considered safe. Again, you're going to want to look for those in a low percentage. Two of the other products that a lot of people might not think to use is the Zeo Sulfur Mask. That's that blue one that you see, as well as the enzymatic peel from Zeo. You can use this one twice a week, and it's really going to help with breakouts. And then the second biggest issue that people deal with during pregnancy and breastfeeding, I find when it comes to the skin, is melasma. And we have talked about hydroquinone and how we can't use that because of the systemic absorption, but that it is great after breastfeeding to use. But here are some products that you can use while pregnant or breastfeeding if you are prone to hyperpigmentation or you find yourself dealing with melasma. So there's two non-retinol based, non-hydroquinone based brightening systems that I really like for pregnancy and breastfeeding, and they're good for different skin types. So the first one that we usually recommend is the non-HQ brightening system from Zeo, which is going to include the 10% self-activating vitamin C as well as their Bright Alive Skin Brightener. So Bright Alive is a non-retinol based skin brightener that's formulated to even skin tone, reduce dark spots, as well as restore hydration and soothe and calm irritated skin. And a lot of women find that with hormonal changes and everything else going on, the skin can be irritated or more sensitive. So this is a really good pick. Because this is a really active vitamin C, I would say that I like this system for anyone who has normal to dry skin. If you find that you're also dealing with breakouts, the vitamin C might not be the best for you. So if you are someone that's dealing with breakouts and melasma, lucky you, you've won the lottery with pregnancy skin, I would then recommend the Skin Medica Lytera 2.0 system. So this is another non-retinol, non-HQ pigment brightening system, and is clinically proven to show improvement in discoloration in as little as 2 weeks. So the main thing we want to think about when we're dealing with melasma or hyperpigmentation is that we want to suppress the melanocytes. We don't want to do anything to stimulate them. So this is a really good product for that. So this product is going to help balance your melanin levels and therefore your pigmentation, as well as it has a non-retinol system that's going to increase cellular turnover. So you're going to get that extra exfoliation that will help with pigmentation without any visible signs of peeling. So those are the two main concerns that I see from people who are pregnant or breastfeeding and not sure what to use. It's usually dealing with acne or pigmentation and melasma. But another thing that you might find is with pregnancy, it's either going to leave you glowing and radiant, or it's just going to suck the life out of you. So if you feel like your skin is dehydrated and just really lackluster, another product I love just to hydrate, plump, glow is the Skin Medica HA5, which is hyaluronic acid based. So with the Skin Medica line, all of their products are actually safe to be used during pregnancy and breastfeeding other than their retinol complex. And then with Zeo, which is our other main product line, because there's so many active ingredients in that line, it's actually easier to list the products that you can use rather than list the products that you can't use. So if you are a lover of the Zeo line, as am I, you can continue to use your hydrating cleanser, your gentle cleanser, your calming toner, self-activating vitamin C, Bright Alive, all of their sunscreens, the primer, broad spectrum 30, smart tone daily sheer, the enzyme peel, firming serum, sulfur mask, growth factor serum, as well as their hydrating cream. Like I said before, always check with your doctor though. As time passes, ingredients change, things get added, things get pulled, so you just want to always make sure you have the most up-to-date information on your products at the time. And as always, the most important product of all is sunscreen. So all sunscreens are generally considered safe during pregnancy and breastfeeding, even chemical-based sunscreens. But if you are dealing with pigmentation or melasma, I find mineral-based sunscreens containing zinc or titanium dioxide are really great for helping protect the skin, protecting against pigmentation. And for those of you who aren't diligent with your sunscreen, I just want to remind you, none of these products are worth using if you're not using sunscreen. It's like taking one step forward, 2 steps back. You have to protect yourself from UV rays. And especially for women who are dealing with hormonal pigmentation and melasma, you want to take it one step further and don't just rely on your sunscreen. I would wear a broad brimmed hat, or of course for me, I love the sun shields. These are great for protecting yourself against UV rays. And if you're not comfortable walking around with this and your big pregnancy belly, at least when you're sitting in the car, sitting in traffic, the summer months, just to keep that UV off of your face. So a lot of women deal with that during pregnancy, and these are a perfect thing to sort of shield you from that. So I know that's a lot of information. If you are pregnant, maybe watch through this and take some notes. Main things to remember: get everything checked by your doctor. The main ingredients to avoid are going to be your alpha hydroxy acids, your salicylics, benzoyl peroxides, vitamin A, so retinoic acid, retinol, as well as hydroquinones. Be really diligent about your sunscreen. Make sure you're avoiding that pigmentation, as well as get any treatments checked out. So you're going to want to avoid the laser and the injectables, but you can do the facials and the micros. Just let your technician know. I know it seems like a long time, but it really is only 9 months for pregnancy, and if you choose to breastfeed, it is totally worth it to just forgo some treatments and products for a little while. And once you are able to get back into things, you're just going to appreciate it that much more. We'll attach a photo of my glow up after my last pregnancy. I went from a shriveled, raisin-looking type creature to myself again. But it is worth it, and congratulations. If you have any more questions about products that you may currently be using or want to use, make sure to book in for a complimentary consultation with one of our technicians or doctors so we can go over everything individually for you and enjoy this time, pamper yourself, soak it all in. You might feel like death, but it's worth it, and one day you'll miss it. I already miss it.